Hello, and welcome back to the Non-Traditional Nurse Podcast. I'm Ellie, and today I'm joined by Haley, a forensic nurse examiner with a background in ER nursing and education. Thank you so much for joining us today, Haley.
Thank you for having me.
Now, I am super excited about this conversation because, I think everyone's heard of forensic nursing, but I didn't really know what the nitty-gritty, day to day looked like. So I think it's going to really clear some things up for people. So today we're going to talk about what forensic nurses do, what a comprehensive forensic exam involves, some of the barriers that patients might face when trying to access the care, and how nurses could get started in this field. So let's get into it. So, Haley, can you start by just telling us kind of your path in nursing and what led you to becoming a forensic nurse?
Yeah, thank you for asking. So it actually started in a moment I will never forget. I was a brand new nurse in the ER. I had one of my very first shifts in triage. For those of you that don't know what triage is, it's basically when you come to the ER and we are trying to figure out if you are dying or not. Do you need to be brought back right away? And I had a patient come in asking for a rape kit. And I remember freezing in that moment. I didn't know what to do. We never talked about this in nursing school. So I ended up calling my charge nurse. She said, "Don't even check the patient in. We're not doing anything for her here. Have her call a hotline number." And that was it. And looking back at it, it still breaks my heart, but it lit a fire in me. I knew that there had to be a better way for this patient population. I ended up going back to school. I got my master's in forensic nursing. I earned my certifications as a sexual assault nurse examiner for the adult and adolescent population. I am an advanced forensic nurse through the Academy of Forensic Nursing, and I have a micro certification in strangulation. Since 2021, I've also been practicing as a contractual forensic nurse at Turning Point, but my bigger vision is to eventually build a hospitalized comprehensive forensic nursing program.
Wow. Well, that is just a wonderful goal for the future. And like, really, that story just gave me goosebumps. It's horrible to hear. It's like how hard it is for someone to come and ask for help and then to have like nothing to offer them is so heartbreaking. So I think that is such a cool thing that you're working on. And I can't wait to see you succeed and really advocate for that patient population.
Thank you.
So, for nurses who might not be super familiar with this field, why don't we break it down to, what does a forensic nurse actually do?
I'd say we are nurses that have had specialized training to take care of patients that have experienced violence, trauma, or maltreatment. So think about human trafficking, sexual assault, adult and elder abuse, or patients that come in with forensic implications such as injuries from gunshot wounds, stab wounds. In my role at Turning Point, that means performing medical forensic exams. But really, we are walking along survivors to meet them where at their worst for all their needs. But what I really love about this field is how wide it actually is. Forensic nursing isn't just sexual assault exams. These nurses can be death investigators. Some work in emergency and disaster preparedness. Some go into legal nursing. There are so many directions you can take with forensic nursing.
Oh, that's good to know. So, once you get the certification and get some experience, there's really like other ways to specialize within the field too. So that's
Absolutely.
something I wasn't aware of. So you talk a little bit about working for Turning Point. So forensic nurses can work, in different capacities, whether that be in a hospital, community-based programs. Can you talk about what the different options are there?
It really depends on where you live. So, only about 25% of hospitals in the United States have sexual assault nurse examiner programs or
Wow.
forensic programs in general, which is a very sad number if you think about it. What that means is a lot of communities are relying on agencies like ours to fill that gap. But in some states, if like think about those patients that live in very rural communities, people may be driving 3 hours just to get that forensic exam, which should never ever be the case. Where I work, we are community agencies. So that means we serve survivors of sexual violence, domestic violence, and human trafficking. We can meet patients at our community site, or we can respond to hospitals in the area. It's really about being flexible and meeting the patient where they are, wherever they need us.
Yeah, I can't imagine needing to, for such a time sensitive exam, needing to like travel or go through such extreme things when you're already going through a traumatic
Right.
experience. Oh, wow. So, something we kind of talked about in our intro call and I found fascinating was the extent of what a forensic kit actually involves and the time that it takes to do it correctly. So, can you just talk about what you do when you're doing a forensic kit or, like a comprehensive forensic exam?
Absolutely. So, in some ways, a forensic exam is kind of like when you go to the doctor's office. We just start by getting a general medical history. Then we'll go through what happened, what injuries that you presented with, if you consent to photographs. We have a fancy camera that sometimes even allows us to be able to see injury that's not visible with the naked eye. We can also collect forensic evidence. What that basically involves is little Q tips, such as swabs, and we would use that to collect things like DNA, saliva, or blood from relevant areas of the body based on the history. We also offer toxicology testing, medications to prevent against STIs, HIV, and pregnancy. And a really big thing that I want people to know is you don't have to pay for this exam. At least in Michigan, we get all of our funding through a state grant called Safe Response. The exam is also completely patient led. They can choose what they want, what they do not want. And in Michigan, you don't even need to be involved with law enforcement to get this exam done, which we know can be a barrier. Our whole role is to focus on the survivor's health and well being. This can also, it's not a quick exam. My average, if we are doing this the right way, it can take anywhere from 2 to 10 hours to complete.
Wow. Is there, a certain window, like, after the incident that really this exam should be done to be successful?
Great question. It depends on what state you work in. At least in Michigan, with what our crime lab is publishing, as long as you have presented 120 hours, 5 days from the assault, you can get this exam done.
Wow, yeah. I feel like there's just not enough information for patients out there to really know. It's like you might be just trying to get through that traumatic incident when this is such a timely thing to make sure that you're getting all the information you need and hopefully, catching people that are committing these crimes. That's really, really important.
Absolutely.
So, obviously, with this being such an important, sensitive area of care, you really felt like you had a calling early on. But what have you found to be some of the most meaningful or rewarding parts of this work?
With me, it's the one-on-one time we get to have with the patients. I came from a very fast-paced ER environment where we were sometimes taking care of 13 patients at once. What I really treasure about forensic nursing is the ability to actually slow down and be present with somebody, to sit with them, listen to them, and make them feel seen during one of the hardest moments of their life. That is everything to me.
Yeah, I mean, I feel like in medicine, we're getting less and less time to spend with patients and to be able to have, hours and hours to be able to help someone through something like this. That is so special. What have you found to be some of the biggest challenges that come with working in forensic nursing?
I think secondary trauma is real and it often doesn't get talked about enough. Absorbing these stories, these experiences, it definitely adds up. And then there's layers on top of that. Based on what we already talked about, we know that there are not enough resources and staff to be able to provide these services. So when you are working in the field, this emotionally heavy without enough support, it really takes a toll on you. And it's something I think that our field still needs to take progress in addressing.
Okay. And I know we've talked a little bit about this, but for patients, like what are the main barriers you're seeing when it comes to accessing the care they need? And, kind of how does that fit into what you're looking at doing in the future?
The biggest one is, as we already talked about, is there are not enough trained providers. In Michigan specifically, the law actually says it is that it's the attending physician's responsibility to complete the medical forensic exam. But most physicians don't even know that that law exists. They never receive training on how to complete the kit. And many hospitals, including the one that I work at, we don't have any forensic nurses on staff besides myself, where these patients start to fall through the cracks. You should be able to walk into any hospital after a traumatic event and get the care that you need, even the forensic medical care. That should just be basic health care. A lot of providers don't even know how to respond to this patient population, which leads to these patients not getting services or the appropriate follow up. I also think that strangulation is a huge area that I see with gaps in provider education. They don't always realize how lethal and common strangulation is. And with that being said, they don't always know like what appropriate imaging and safety planning we should do with these patients as well.
Yeah, and I can't imagine there's a single ER doctor in the world that has 8 hours to complete an
Yeah,
exam. So, wow, yeah, it just really speaks to the need for all of this, especially like you said, someone comes into a hospital, they've gathered the courage to do that and they say, go home, like find somewhere else to be treated. Like, chances are they're not going to come back for that another
right.
time. I'm sure you've seen that. Wow. So when it comes to certification, you obviously have several different certifications. So I guess what is required, what's first steps, and then what's available?
Great question. So, my first advice would be to get a clear idea of what part of forensic nursing interests you, whether that's sexual assault nursing, death investigating, legal nursing, and start networking. Get plugged in with organizations like the Emergency Nursing Association and the Academy of Forensic Nursing. They have several community threads when you are just starting out to be able to network and get you where you need to be. Certification wise, the Academy of Forensic Nursing offers some options, but they're not technically required for the job. Regarding sexual assault nurse examiner certification, unfortunately, that has been temporarily paused while the organization that oversaw that certification recently ended. So we're kind of in a weird period where we are trying to figure out what happens next for the future. And what
Okay.
I really want people to understand is you don't need everything lined up before you start. Some sites will train you on the job if you are passionate about it. A background in emergency nursing or women's health is extremely helpful, but I've had some colleagues that work in pediatrics, ICU, poison control. If you have the heart for it, that goes a long way and you can do it.
Yeah. And, I find, especially when exploring new careers, like some of the most valuable things you can do is like a shadow experience. Is that something that you see allowed? It's such a sensitive area. So I don't know if that'd be
It depends on the organization. Like you said, it is such a sensitive area where they don't always allow people to shadow, at least for the exams, but they may allow you to come do an office visit and at least sit with the experts.
okay. And it seems like, in something this difficult, and I think thinking about a nurse and what they might have been through in their life, it's not gonna be for everyone, and so I think the advice of really talking to forensic nurses and asking hard questions about what your day-to-day looks like and making sure that that feels right for you is so important. So, something we like to talk about with every interview, if you are a bedside nurse and thinking, forensic really feels like something I might be interested in, what is your advice? I know you probably touched on it a little bit, but what's next?
Say go for it. At least with forensics, it gave me my passion in nursing when I was previously extremely burned out. But please make sure you are taking care of yourself. That's not a bonus, it's a requirement in our field. You can't take care of someone if you are not taking care of yourself. Our patients deserve us at our very best. Build your support system, find your people, protect your own well being. The work is so worth it, and you are too when you finally come to us.
Yeah, that is great advice. It's like the way overused analogy of like putting your oxygen mask on. You really have to be able to help someone through a situation like that. So, well, thank you so much. I feel like in a short time we were able to cover a ton about forensic nursing, and I feel like these interviews it's almost like your first step if you were to reach out to a forensic nurse and ask them some of these questions. We're trying to cover that for you. So, thank you, Haley, for sharing your experience and really giving us a good understanding of forensic nurses and the importance of them. And gosh, I just hope in the future that we see them in every single facility because we know how prevalent sexual assault and these injuries and traumas are. So thank you again for coming.
Thank you for having me.
And to our listeners, if this episode taught you something new or introduced you to a nursing path you hadn't considered before, make sure you're subscribed to the Non Traditional Nurse so you don't miss any future interviews and career deep dives. And please pass along to a friend. So thanks for being here, and we will see you next time.